Good topic. Most patients want to know, what can I do as a preventative mode? I'm all about preventative and preventative care. And so with dry eye, there's a huge environmental factor. So they'll be considered an astringent factor. One is the computer. We know that extended computer device or tablet time increases your risk for dry eye disease. I'm going to go back to those oil glands. They live in your eyelid and they're stimulated when you blink. And we know that when you're on a device or a tablet throughout the day, consistently, it diminishes your blink rate. There have been some studies to show that your blink rates diminish about 50%. So you're blinking about 50% less throughout the day. So that means that your oil glands are not being stimulated properly. So that is going to significantly increase your risk for discomfort or dry eye disease. So that's one. Two, diet. Make sure you eat a nice balanced diet. We have a lot of processed foods and things that are in our diet. We're not really good about getting those certain vitamins and nutrients that are needed to keep our eyes hydrated. We do know if there is a deficiency or a decrease in omega-3, specifically omega-3 complex 3, 6, and 9, that you may have more issues with the oil that lives in the oil glands. So you have the meibomian glands, and the oil is called the meibum. There are things that you can do when you're eating to make sure that that meibum that is being made in the body is healthy. So nutritional things is important. So make sure you eat a nice balanced diet. Simple things too is make sure you manage your stress level and water intake. So if you're stressed out, if you're not sleeping well, if you're not drinking enough water, those are just going to affect your overall body. And we know if you're dehydrated, if you're stressed out, that's going to exacerbate any potential disease condition that you may have. And dry eye is no exception. And then lastly, get regular exams. Sometimes you may be suffering from certain things and you may not realize that it's a disease or early disease state. Dry eye a lot of times gets brushed off of allergies. Or, maybe this is the way that my eyes are supposed to feel. A lot of patients report symptoms, but they're not good about being actively seeking someone out to help reduce those symptoms because your eyes don't have to feel like that. So a simple or regular routine exam. With our routine exams, we're always screening for eye disease, specifically dry eye, asking the right questions so that we can elicit if you're really truly having an issue. So those are some simple things that you as a patient can do to just minimize your risk for dry eye disease.